Assalamu alaikum, hello and welcome to The Health Show here, only on the Islam channel, with me, Alistair Greener. Each week we're joined by a health expert within their specialised field and we discuss the prevention of health issues or concerns that we or our loved ones may face. Looking at how you can change your health and lifestyle for the better, The Health Show offers an alternative viewpoint from our health experts who attend the show, which we really hope will help guide you in the right direction. Now, if you'd like any further information on our programmes or any of the topics that we discuss, please do then get in touch at healthshow@islamchannel.tv and we'll give you that email address again at the end of the show. Today, we're looking at HIV tests. We'll be looking at the HIV testing process and its importance, as well as the value of knowing our HIV status. It's a pleasure to welcome the team members from Positive East, who are going to explain more about testing and they're going to show us ways to improve our sexual health. Positive East has been on the forefront of HIV service and care for over 26 years, where they've been supporting people from the moment of HIV diagnosis to longer-term care. It's easy to get tested for HIV and the services offered at Positive East for HIV and STI testing are free, fast and totally confidential. To discuss this further, I'm pleased to welcome Alyssa Ferry and Badru Male. Thank you so much indeed for coming in.
Thank you so much.
It's great for chatting to you. I'm just going to give our audience a little bit more background about you, because Alyssa is currently working as an HIV prevention and testing manager. She's responsible for Positive East's HIV testing and prevention projects. She's worked in the field of sexual and reproductive health for nearly 10 years. And joining her is Badru, who is an HIV prevention and testing coordinator for African communities at Positive East. He's trained as a public health specialist and is also a founder of the African Communities Involvement Association, where he's developed a strategic outreach program engaging African communities in tackling the challenge that HIV presents. And again, as I say, great to have you both on the show. Such an important subject, but also it's a subject that people, still feel quite uncomfortable talking about quite often, don't they? Why do you think it is so difficult for people to talk about it? What do you think, Alyssa? What's the big issue for you?
I think there's just a lot of fear around HIV. I think we all remember the campaigns, 20, 30 years ago that struck a lot of fear in people's minds, thinking that HIV was a death sentence. And we're really here today to let people know that that's not the case. It's not a death sentence. There are, thousands and thousands of people in the UK that are living full, happy, healthy lives with HIV.
But again, it's obviously still a really serious disease. It's still a really serious matter that people need to be aware of, which is why testing and things are so important. And you're obviously doing a lot of work, as you said there, Badru, in the African community. What are you noticing there particularly in terms of people's attitudes and people's thoughts about HIV?
In the African communities, there are many people who don't have the awareness of HIV. And what they believe in are really myths, and myths breed fear. So they are scared to talk about HIV, and still they remember the earlier campaigns where, the tombstone was broadcasted, and then they say, don't die of ignorance. So it is a mixture of stigma and fear.
And of course, in Africa, when AIDS first came to light, Africa was one of those centres of focus, wasn't it? A lot of people were talking about Africa and trying to educate people there to help the prevention of the spreading of the disease, weren't they?
Yes, that's right. Many countries in Africa did ignore the epidemic when it was actually spreading. Few countries came up and said, yes, we have a problem, let us address it. But those who stayed in denial actually didn't help their populations, and HIV was spreading within the populations without any control.
And this is why, of course, Alyssa, it's so important to identify whether someone has HIV or doesn't. What's changed since that big campaign in the mid-80s in terms of testing and awareness?
Well, the biggest change is that there's medication that people living with HIV can take. It can be as easy as 1 pill a day. If someone is diagnosed quite early after they've acquired HIV, they can live for they can have the same life expectancy as someone who's not living with HIV. So treatment has really revolutionized HIV in the UK, but across the world.
And to put this into some form of perspective, is if HIV isn't treated, the consequences can be very serious, can't they?
Absolutely, yeah. And I mean, it can be fatal, definitely, if someone does not take medication. Yeah, and the earlier it's treated, the better. If someone has HIV for 5 or 10 years without knowing it, HIV will start to damage their body. And so this is one of the things that we really want to do, is make sure that people test regularly and find out they have HIV quite early so they can start treatment.
And just before we get to the testing thing, we associate HIV with AIDS. Perhaps you could tell us a little bit about the difference and how they connect.
Yeah. So HIV is a virus, just like the flu. It's a virus that lives in our bodies. What it does is that it weakens our immune system and it makes us vulnerable to attacks by other conditions like TB or meningitis. And once, if someone is living with HIV and they get some other illnesses, that is what we would call AIDS. But we don't use the term AIDS so much anymore, maybe.
Yeah, because there's been effective treatment, and the word AIDS does stigmatize HIV. So we use advanced HIV disease. And that's what Alyssa has just explained. If people test early and they are diagnosed with HIV, then they start the effective treatment that we have at the moment, and they will never reach that stage where they have
It'll never progress.
Never.
Exactly.
Right. Yes.
Exactly.
And you know, we're talking about this time that it takes to make sure that you get tested, to make sure you are aware.
Absolutely.
How much time are we talking about? What's the significance of the time between contracting it and it advancing and obviously, hopefully not to the point that you've been talking about?
Yes.
What's the time frame are we talking about?
We talk about, for us in the community, we talk about 12 weeks. That's about 3 months. Because when somebody is infected with the virus, it takes some time for the antibodies to develop in the body. And these are the antibodies we are looking for. In the clinics and some GP surgeries, they have kits that can diagnose those antibodies in about 4 weeks. So the best period, what we call the window period, is about 12 weeks.
Okay, so and this is really valuable information for people to understand, what they should be doing and so on. And the real key about, HIV today, as you said, it's not the death sentence that it once was. This is something that is extremely treatable, but the importance of getting tested is just absolutely crucial, isn't it?
Absolutely. So like Badru said, a test will show that someone has acquired HIV 3 months after acquiring the virus. So what we would recommend is that if someone feels like they might have been exposed to HIV, to come get a test, like Badru said, with our tests 3 months after that time. If someone is feeling a bit more anxious, they can go to a GP surgery or a sexual health clinic after 4 weeks already to get a test, and it could show positive if HIV has entered their body.
And what about people who don't have a particular instance where they think they might be exposed to it, but just as regular good health? What's the sort of frequency that you should be testing?
Yeah, so what we would recommend is anyone who might be in a relationship to get tested about once a year for both HIV and also other STIs.
Okay, good advice. Mm-hmm. You talked about being exposed to the virus. How does one become exposed? Again, there was a lot of misinformation, especially in the early 80s, about this. And of course, the late Princess Diana did a huge amount of work in helping people really understand, how it can and can't be caught. Go through that again for us very briefly, what makes you vulnerable to being exposed to it?
Yeah. So there's different ways that people can acquire HIV. One of the first ways is being intimate with a partner who has HIV without using a form of protection. Another way is from a mother to her child during pregnancy, delivery, or breastfeeding. And blood can also transmit HIV. So anything that would be a sharing of blood, for example, a blood transfusion where the blood has not been tested for HIV, sharing needles and things like this. But like you said, there's a lot of ways where people think that, oh, maybe I can get HIV. So maybe Badru can tell us a bit about
so let's talk about some of the myths here.
The myths, yes.
Yeah.
Many people think that if you use one cup or glass with a person who has got HIV, it can be passed on. It will never be passed on. Insect bites will never pass on HIV from one person to another. Using the same bath, using the same swimming pool, using the same, toilet, you'll never get HIV. HIV, it lives in the blood and can only be passed on through body fluids. At the same temperature, at the same alkalinity, and at the same conditions where it lives. By the way, the virus is so weak that it can rarely live outside those conditions.
And what about saliva? That was one of the big topics.
Saliva, through kissing, you'll never pass on HIV.
Okay,
through
good.
saliva.
Glad we've sorted that out. Now, people will have noticed that on the table we do have a kit here, which is to show exactly how easy it is to actually have an HIV test. And in fact, before we went on air today, as you'll see, I've got a little plaster on my finger here. I've actually already had the test, but we're going to show you it again one more time, show you how simple it is. So we've already been through the process. I already know my results, but we're going to show you again just to see how simple and straightforward it really is. And trust me, it doesn't hurt one iota, I can assure you, which is why I'm quite happy to have it done twice. So let's talk about the actual process. So Alyssa, if you could talk us through there very slowly, pointing out the equipment that you have there.
Yeah, absolutely. So this is an HIV test. It will give us your results after about 5 minutes, so it's very quick.
So just turn that round a second, just so you can see the label there.
Yeah.
So that's the kit that you would use,
Yes.
and that's the same kit that any clinic would use. It's essentially this kind of kit.
Yeah, so there's different types of HIV tests. The type that we use, this instant test, can detect HIV 3 months after an exposure. In some clinics, they might decide to take a sample from the vein, which can detect HIV 4 weeks after someone has acquired it.
Okay, so, but this is a nice, simple, easy test.
Yes,
okay, so open up the packet, and again, we should stress that all of these have been sort of medically sealed,
Yes.
So they're completely safe.
Definitely.
Okay, and I know you've also got some gloves there as well that you're going to use, haven't you?
I do. So this is the HIV test.
Okay. So the other one that we see there on the table, that's the one that's been done already, but we're going to come to that in a moment.
Yes.
Okay.
So we've got a plaster for you.
Okay.
And a little single-use needle.
Okay. Now, I'm someone who gives blood, so I recognise these. So whenever you give blood, they do a quick little test first, and that's effectively the same thing that you're about to do here.
Yeah, exactly.
Okay. So if you've given blood, this is actually just that initial test. It's no more than that. So really simple. Okay.
Yeah, and it just takes, less than 1 drop of blood from your finger. It's really very, very simple.
So the next stage is, and I noticed that Alyssa's actually got coordinating gloves here. Not necessary all the time. It just happens to work on this occasion. But obviously, again, we're dealing with blood, so we've got to be very safe and secure with that.
Definitely.
And maintain the hygiene conditions there. Okay.
Great.
So the next stage is to actually take the blood. So I'm going to lean forward and hand you. Now, you asked me before, didn't you, about which hand, whether I'm left or right-handed?
Yes.
And I said I'm left-handed, so you take it from the left hand normally.
Yeah, so we can take it from any finger that you're comfortable with. The left hand is quite easy. It's the closest one to me, so we can do that.
Perfect.
Yeah.
Right.
Great. So I'm just going to take this little tube of solution off of there.
Okay.
All right. And I'm just going to clean your finger off a little bit.
So this is one of those hygienic swabs,
Exactly.
which just makes sure, again, that everything's kept completely clean.
Exactly.
And it's a very small hole that it makes, so I'm not going to wind up looking like a colander by the end of the day. So this is okay.
All right. So
okay.
it'll just be a little finger prick. It'll just be a scratch. 1, 2. All right.
And to be honest with you, that feel is even less than you'd get if you caught your finger on a thorn bush or something like that. It's so light and it's really not significant at all.
All right,
Okay.
so this is the test. I'm just going to get some blood in there.
So you've just taken literally just a few drops.
Yeah, tiny amount of blood. If you just want to pop that cotton and hold it down.
Okay, so I just hold that to keep to seal it.
Yeah, so I'm just going to put the HIV test in the solution.
Okay.
And yeah, then we'll just wait for 5 minutes for your results.
It's extraordinary, isn't it, that that's just in 5 minutes. How long has this kind of test been around that it's been that quick to get a result? Because, you know, people might remember back in the 80s and 90s, Badru, you must remember, you know, it took a long time, didn't it? So what changed and how long has this been around?
This has been around for the past 5 years.
Okay.
And we have extended it to the communities in the last 2 years. The good thing about this is that you can do point-of-care testing anywhere in the park where people congregate. You can go to the mosque and do it. You can go to the churches. Anywhere you can carry it, as you've seen, it is so simple, and it gives the results there and then. In the past, as you said, you know, people used to give a lot of blood intravenously, and they used to get results within, I think, 28 days.
Good, yes.
After taking the test.
It's a style of the world we live in, isn't it?
Yes.
Everything's much quicker and more instant. And of course, for people who are concerned, you know, as you say, they might fear that they might have been exposed for whatever reason. You know, for them to be able to have that assurance of knowing that they will know one way or another that quickly is great. And I suppose also you're saving a lot of time in terms of diagnosis. That's 1 month earlier that you can actually get on with treatment if somebody indeed has been exposed to it.
Absolutely.
Exactly.
Absolutely.
Yeah, sure. And also the cost of testing has reduced considerably, which makes it really very cost-effective and at the same time promoting health in communities.
A lot of people, of course, on others, and we're just using, by the way, the 5 minutes before we get the final result. I do know the result already because we did it earlier, but just to show you how quick and simple it is. But, you know, things have changed massively with this. And, you know, people's reaction to the fact that it can be done so quickly has got to be one of relief. But what's still preventing people from coming to you? Because you're here today to really make sure that people do come to you. So what's preventing them from doing that?
I think fear is a huge component. Fear of the stigma that Badru talked about. If I'm found to be positive, will I die? Will I be rejected? And, you know, we really want to make sure, support people through that process, for them to realize that there's a lot of support available out there through organizations like Positive East, where we have a lot of support services. We have a big team of counselors, we have a psychologist, we have a whole team that is focusing just on health and well-being activities, immigration support, welfare advice for people who are living with HIV. On top of, you know, the clinicians who are there to give medication.
That's the main thing, really, isn't it, to give that assurance. Now, I've kept that on there for a few minutes, and I know you've got a plaster there, and I mean, that is not actually bleeding anymore, but it's always good to put a plaster on to keep it nice and clean and safe. And you'll notice that we have down here on the side, we have what they call a sharp spin, which is where all of these sharps go, so they can't go anywhere beyond the box, and then, of course, they're disposed of in the traditional medical way that we do. And also we've got for the non-sharps waste, shall I wrap that round?
Yes, please.
The non-sharps waste there, we've got our the bag. So I will pop that there, and then all of that can be disposed of.
Yes,
excellent.
Perfect. Thank you very much.
So we've got a couple more minutes maybe just before the break, rather handily. We're going to get the results. The key thing as well, Badru, is that having the results there and then means you've got all the clinical help and advice straight away. You don't have to come back. You don't have to open the results by yourself. So what's going to be the first thing that happens when, let's say I'm in a clinical situation now, I've just had the test. Do I go out of the room or do I just sit there chatting to you for a while? How does that work?
We have a test discussion, what we call test discussion. We have a pre-test discussion where we explore, the people's past, how they have exposed themselves to risks, and it is a whole assessment. And after the test also, we have a post-test discussion. And this discussion is about giving the person the result. If it is a reactive, what we say reactive, which means maybe positive, we refer them through a clear pathway to a sexual health clinic where they can take more blood, and also connect them to services that Alyssa was talking about, the support services, psychosocial support, health and well-being, and other services that people may need at that time.
So if you have this test, what
Yes.
are the chances of it being inaccurate? So you say obviously you go for further testing. Is it pretty 99% sure, this test, that if it does react as you say,
Yeah.
then you will need treatment? So it becomes just a backup test?
Yes, these tests are quite accurate. As I said, after 12 weeks, and the accuracy is about 99.96%.
Okay.
Yeah. The reason why we refer them to the GAM clinics, to have a conclusive test, is that apart from really identifying the antibodies, those tests will reveal other things like how much is the virus, how long has this person had HIV, and things like that. And that's why we refer them to those clinics, to make sure they have enough blood to determine all those things.
Well, after the break, we're going to talk more about the support. We're going to talk about the treatment and so on. But before we go to break, we need to give me my results.
Yes. So this is the test that we did earlier.
Okay.
So your HIV result is negative, which means that this test did not detect any HIV
And how,
in
if
your
you can keep
blood.
that really still, how can you tell that from looking at it?
So if we look at it, you'll see that there's one line that's
Yeah.
appeared. This is the control line. It's just showing us that the test actually worked. There's no second line. If there was a second line, that would mean that the test is reacting. Like Badru said, reactive. It's reacting to HIV in your blood. There's no second line. There's no reaction. It is negative.
Which, for the majority of people who come and see you, that will be the result that
Yes,
they get.
definitely.
Thank you very much indeed. It's been great finding out about that. We're going to clear this up. We're going to go to a break. And when we come back, we're going to talk more about the various treatments that you can actually get and the support you'll get as well. Now, we must stress that should you suffer from any medical problems or health concerns, it's always highly recommended that you contact your doctor or GP, as the Health Show gives you an alternative viewpoint to the health concern being discussed. We'll see you straight after the break. Welcome back to the Health Show, where today we've been looking at HIV testing, and we've been joined by HIV Prevention and Testing Manager Alyssa Ferry and HIV Prevention and Testing Coordinator Badru Mali, both from Positive East, whose mission it is to improve the quality of life of individuals and communities affected by HIV. Now, before we talk more with our guests, we're going to take a look at a clip about PrEP, which is a pill that you can take to protect you from HIV. Let's take a look.
Hi guys, how are you doing?
It's coming.
I have something to tell you. Nabu is taking some pill called PrEP. He says it's to protect himself from getting HIV.
Does he have HIV?
To protect himself.
Has he been sleeping around?
How would I know that?
Young girls, let me tell you something. 11 years ago, I was diagnosed HIV. I wasn't sleeping up and down. I was married, and how I got it, there I was. When the diagnosis came, I looked at the mortuary and death. But the following morning, the doctor put me on medication. That's how you see me cooking for you, strong and life. So this PrEP was not there. Even though I was married, I would have been taking it like a protective pill, like I can protect myself from not getting pregnant.
Are you saying that you take that PrEP thing and it stops you getting HIV?
Yes. It is just like when you want to go to Africa, not to get malaria, you apply for anti-malaria. That's what it's going to do. You understand me?
Oh God. When did I last test for HIV? I've slept with 1, 2,
Even Peter. I better go and get tested and look into this PrEP thing.
And take control of your sex
Definitely going
life.
to look into it.
Food is ready. Food is ready.
Enough lecture. Let's see.
Now, again, we saw that's something that's very new, isn't it? This PrEP tablet. Tell us a little bit more about it. We've got a good indication from the VT there that it will protect you. Tell us, first of all, what it is, how it works, and then who is this aimed at? Who should be taking it?
Yeah. So PrEP, what it means is pre-exposure prophylaxis. It's like in the video, it's something that you take before you have HIV, when you don't have HIV, to protect you from getting it. Most people will take just a pill a day, every day. Even if you don't have a risk that particular day, you can take it continuously, and it can really protect you. And like you said, it is very new, only in the past few years.
And is this, who would be typically taking this? This isn't for the general population, for everybody, I presume, or is it?
It's for anyone who feels like they could benefit from PrEP. It can be for people in relationships, outside of relationships, people who are not able to protect themselves from HIV in any other way. PrEP can be for everyone.
So it's basically for people who feel they may be at risk of contracting HIV. And again, we in the first half of the show, we took some samples from me. We found out that I wasn't reactive, therefore that I don't have HIV. But talk me through the process, Badru, maybe, of someone who maybe comes to one of your clinics who they've gone through that same process as I did, and then 5 minutes later they find out, and as you said, it's a 99.6% chance it's successful. Talk me through the process. What's going to happen to that individual from that moment onwards? How do you take care of them?
Right. If somebody's test results come out reactive, that's when we say it is positive. Imagine somebody testing positive for the first time and the emotions they go through, all the history that comes back, the anger they have. So we do our post-test counseling, which is really not counseling but discussion, and we talk them through what is going to happen next, and immediately we trigger a referral to a sexual health clinic where some more blood is taken to determine how long these people have had the virus and how they are going to start medication. So as long as we refer them to the sexual health clinic, then the sexual health clinic takes over and they deal with that patient. So we do the post-test discussion, we do the support, emotional support, and we refer to sexual health clinics.
And at the sexual health clinic, what happens there in terms of the treatment that they might get? Does treatment start straight away? What's the thing happens? So listen, maybe to take over from this point.
Sure. So once we've referred a client to a sexual health clinic, they'll get a blood drawn, and after a few days, they'll get their confirmatory result. If they are confirmed to have HIV, like Badru said, they will have a good idea of how advanced what the virus has already done in their body. And the sexual health clinic from that point will refer them to an HIV consultant, so a medical doctor who can start them on medication. It can be within a few days. It's also a discussion with the person to see when they feel ready to start medication. And organizations like Positive East in London, we can then be working with those clinics to also provide some of the emotional support that is necessary.
And that's a massive part of this, isn't it? Having that emotional support, and especially today when we look at sort of mental health concerns, something like this could really, have a tremendous impact on an individual, despite the fact that the prognosis is actually good these days. It's still life-changing, isn't it? Because you're going to be taking some form of medication for the rest of your life.
Yeah, it's life-changing, but it's not life-ending. And one of the very powerful aspects of an organization like Positive East is we have a lot of peer mentors. So they are people living with HIV who've been trained to support other people living with HIV through the journey of their diagnosis, that can meet with them at the point of diagnosis, but it can be years later as well, whenever people need support, and that they can have that support from someone who has had similar experiences to them. So that can be very powerful.
Now, there's a couple of things that obviously comes out of this, is people are going to start learning a whole new array of terminology. And we've seen PrEP there. Now, there's also PEP, so maybe you could explain the difference between that.
PEP is post-exposure prophylaxis. It works the same way as the morning after pill that usually people take. You have to take it within 72 hours. That's about 3 days. If you've been exposed, or if you have identified that you were exposed to the risk of acquiring HIV. Now, PEP is given in any accident and emergency and any sexual health clinic. Post-exposure prophylaxis also, it works the same way. It is an HIV treatment pill, which is very, very accurate, very, very effective in stopping HIV infection to occur.
Great, so that's good. We've cleared that one up. The other terminology I hear is that I was aware of the campaign of the U equals U. Tell us a little bit more about that.
Yeah, so I'm glad you brought it up, because this is something that's very new and that's very exciting. So U equals U. The first U means undetectable. So basically, when someone who's living with HIV starts treatment, the number of viruses in their blood will become really quite small. And it will reduce to the point that their viral load, the number of viruses in their blood, will be undetectable. And what we've realized in the past few years through a series of large studies is that someone who is undetectable is untransmittable. U equals U. Someone with an undetectable viral load cannot pass on HIV to their partner.
Wow, so that's pretty clear, isn't it?
Yeah, so
okay.
It's really exciting. It means that if your partner is diagnosed with HIV, once they're on treatment, once they get to the point of undetectable, there is no risk of you acquiring HIV from that partner.
And really of great comfort for a lot of people who, might be in a relationship with somebody who is affected. Let's talk a little bit about, because obviously we've talked a lot about the fact that if you do contract HIV, that actually, as you said, it's life-changing but not life-ending, and there's a lot that can be done in terms of emotional support as well as physical support. But let's talk about the prevention side just for a second, and then we'll come back to the testing and the treatment. What's the best way to prevent any form of chance of getting HIV in the first place?
Yeah. So there's we've already talked about how someone can acquire HIV. So through being intimate with someone without using any protection is one of the ways. So using protection is one way that we can be quite sure of preventing HIV. Another way is just to regularly get tested. To be sure, if everyone is getting regularly tested, that means that anyone who is living with HIV will get to the point of taking medication, becoming undetectable. Someone who is undetectable cannot pass on HIV. That is preventing HIV to their community, to their family and their community.
Excellent. So really good advice there. Coming back to the testing, a lot of people hopefully are going to be watching saying, this looks so simple, so easy. You know what? It's not a big deal. I'll go and get myself tested. How do they find out about where they can go to get tested, wherever they are within the UK and maybe beyond?
Yeah. So there's a lot of options. If someone wants to get an HIV test, there's a lot of options.
We have a lot of testing centers in the community. We test in the libraries. We test in community centers. We test in refugee centers. In any place, we test in places where people who are taking, addicted to alcohol go for their rehabilitation. So there's a lot of testing places in the community. And then there is testing centers as well in GP surgeries and sexual health clinics. There are other organizations that are like Positive East also testing elsewhere in London and national at large.
Because there'll be some people, won't they, who will feel some form of stigma about going to their GP who maybe they've known for a long time.
Surely,
They'd rather go
exactly.
somewhere completely anonymously because they
Yes.
don't want to. Although a GP, of course, would never ask any questions. They're just plain do the test. But people sometimes feel that they would rather their GP didn't know that they were having the test.
Yeah, I think people shouldn't be ashamed of having a test. Getting tested for HIV means taking control of your health and of your family's health. So there's absolutely no shame to be had of having an HIV test. But what we really want to make sure is that everyone has the choice of where they would like to go. So like Badru said, people can go to their GP, people can go to a sexual health clinic. If people live in the majority of the boroughs in London, offer test kits that you can order online. SHL London, SHL is Sexual Health London. You can actually order an HIV and an STI kit to your house for free. You can take the blood yourself, send it to the lab, and you'll get your results after about 1 week by text message. And like Badru said, there's lots of community organizations in London and outside of London who will offer HIV testing free, confidential, as a walk-in service, very discreetly, in a variety of locations.
And it's interesting, one of the things we've stressed is confidentiality, and of course there's nothing much more confidential than the kit coming privately to your house where nobody knows what it is.
Yeah.
Yes.
You send it back, you don't even have to see anybody.
Yeah.
But the key here is to make sure that you do actually get tested. Now let's say you did go down that route. Again, the whole confidentiality continues into the whole treatment and the emotional support and everything as well, doesn't
Definitely.
it? Tell us how you do that at at Positive East.
At Positive East, as Alyssa said, we don't post out kits. It is Sexual Health London that does that. But when we go out to communities and test people, we provide a confidential HIV test. And when people are, testing at that time, all the information we get is confidentially kept with us, and we assure them that it is so confidential and nobody, has access to it. Unless really that information, by disclosing it, it will benefit the person who was tested.
And yeah, incredibly important.
Yeah, so it is confidential within our service, within the medical professions and people working to improve that client's healthcare. If someone is diagnosed with HIV, nobody will disclose that status on their behalf. No health professional will call their partner, will call their family. That will never happen. No. What we can do is support someone to share their status with their family members, but we will never share someone's status on their behalf.
Yeah.
And what about age here? Because one would probably assume that sort of younger people might be slightly more at risk because they tend to be a little bit more active in this sense. But what would your advice be in terms of beginning to have the test? At what age maybe that they could start having the test and right up through later life? What's your advice on that?
So at Positive East, we test people starting at the age of 18. If someone younger than that is interested in getting a test, they can go to the sexual health clinic. Whenever someone is beginning to be at risk of HIV, it's always a good time to get an HIV test. When entering into a relationship or when entering into a marriage, it's always a good idea for both people to get tested. And if someone has never had a test and they're 90 years old, why not? It's always a good idea to know your status. The only way to know your status is to get a test.
And at the end of the day, there is that thing we talked about before about the fear of the outcome. And, let's be honest, a lot of us, and especially men, Badru, right?
Yeah.
We put our heads in the sand and we'd rather not sort of think about it. And if we put it at the back of our minds, we don't have to. Yeah. Let's say somebody's watching right now and they're saying, I know they're right and I know I should, I really should get this test, but I somehow just can't pluck up the courage. What would you say to them?
I would say that it is better to know than not to know. As we said earlier, if the test is reactive, is positive, there is a very effective medication that you can take and continue to live a good quality of life. And then again, we said that if somebody knows their status, they are unable to pass on that virus to other people unknowingly. So it is, a win-win situation where you go for a test, it's positive, I start treatment before I get to what we call advanced HIV disease. And then you won't be able to pass on the virus to some other people without knowing. So this is the encouragement that we have.
And it's great that we can talk about these things. We've had a number of people on the show talking about cancer and talking about things that maybe 30, 40 years ago people never talked about. As a result of this, of openness, have you seen a lot more people actually coming to you and talking about it? Are you finding that people, although there are still some who are reluctant to, but actually more and more people are now coming forward?
Certainly, yes. Many people are coming forward. In the past, people used to concentrate on thinking about the myths. But the more we educate people, the more they are confident, they get confident to talk about HIV in the community. And also, the more they get the confidence to test for HIV.
And one of the things that's really stunned me here, Alyssa, is the technology that's advanced. From the testing now within 5 minutes to the fact we've got PrEP there to help and PEP. Where's this all heading? I mean, what are we looking at in the future? Is there any more new exciting developments around the corner with HIV? Because we seem to have made unbelievable progress in a relatively short period of time.
Yeah, I mean, you're right. There's been so many new innovations. And so for the moment, we're focusing on getting all these innovations to the people, to the communities, to the people that can benefit from them. But absolutely, there's a lot of new developments. People are always talking about, could PrEP be, an injection or an implant? Could we, instead of taking 1 pill a day for PrEP, could we just have an injection and it could last for 2 or 3 months? Same for ARVs, antiretroviral medication, for people who are living with HIV. There's a lot of exciting ideas. Scientists and companies are working really hard to try and develop some new medications that would ease the burden, the pill burden, for example, on people who are living with HIV.
We know that today it's very difficult to get your message through sometimes. There's so much noise out there on social media and everything else. You're obviously coming on the show today, but what other things are you doing to really help get this message out there that it's so important to get yourself tested?
Well, these days, definitely many people are hooked on social media, and we use social media a lot. But at the same time, we recruit from the communities volunteers or health buddies that go out to their particular communities and distribute this information to make sure that the information reaches to really the people who need it. These are ways that have been working, and we continue to improve ways of really disseminating information to wider communities.
And of course, we're incredibly lucky here in the UK with our NHS, which is incredibly supportive and provides so much help to people with, a huge variety of conditions. What about worldwide? Where do we stand in the UK compared with the rest of the world when it comes to HIV detection and treatment?
Yeah, so that's a great question. A few years ago, UNAIDS, which is a UN body that works to reduce the burden of HIV around the world, issued a call to action to the whole world saying that by 2020, we want to get to the point where 90% of the people living with HIV have been diagnosed, and of those, 90% of people should be on treatment, and of those, 90% of those people should be undetectable. Should have an undetectable viral load. So we've all had a call to arms that we should reach 90-90-90 by the year 2020. So here in the UK, we're doing incredibly well. We've already achieved that target, actually, quite recently, so we're ahead of the game. But it's not so easy everywhere. There's a lot of barriers to accessing testing, a lot of barriers to accessing treatment, and medication and staying on medication. So we're quite lucky.
But for all of our viewers watching, the message here today is go and get yourself tested. It's simple, it's easy, it's confidential, and most importantly, it's also free.
Yeah.
Thank you so
Yeah.
much indeed for coming on the show. We really, really appreciate it.
Thank you very
Unfortunately,
much.
that's all we have time for. I'd like to thank our guests today, Alyssa Ferry and Badru Mali, for coming onto the show and to talk about their expertise, which has been great. Once again, we must stress that should you suffer from any medical problems or health concerns, it's always highly recommended that you contact your doctor or GP, as the Health Show gives you an alternative viewpoint to the health concern being discussed. If you'd like to find out anything more about today's topic, or you're interested in getting a free and confidential HIV test, then please do get in touch and email us at healthshow@islamchannel.tv. Again, that's healthshow@islamchannel.tv. Thank you again for watching. We'll see you soon. Assalamu alaikum.